and welcome to today's Counter Weapons of Mass Destruction Future event with Dr. Asha M. George and the future of biodefense. A few housekeeping items up front. Today's session will be streamed live via VBrick platform, and we will be recorded for future use. Questions from the virtual community and audience via the chat feature are encouraged and welcome and will be addressed at a time following today's event. If you have any technical challenges, please reach out to the audiovisual team. Their contact information is located at the bottom of the VBrick screen that you're seeing now for our virtual audience. Thank you for joining us today. And my name is William King, and I am Booz Allen's Senior Fellow and co-lead with Todd McNutt on the Countering Weapons of Mass Destruction space for Booz Allen. We are living in a time of increased volatility and complexity as evidenced by the global pandemic of COVID-19. The reappearance and use of Novichokes, the continued development of chemical and biological weapons, and the ability to deliver these weapons by new intercontinental ballistic missiles and swarm unmanned aerial systems, just to name a few of those threats. Yet we're also entering a new year of promise in our enduring mission to counter these weapons of mass destruction threats, both from the recently announced American Pandemic Preparedness Guidance out of the White House, the 2021 National Strategy for COVID-19 Response from the White House, and the Bipartisan Commission on Biodefense, Apollo, and Biodefense in Crisis reports. These well-thought-out recommendations provide a strategy, guidance, and momentum to take our lessons observed and transform them into actual lessons learned, emphasizing that our government must act now and not put off action any longer. I would offer to you reformatted strategies and reorganizations alone will not suffice and sufficiently protect our nation from these highly complex, multi-regional, overlapping threats by adversaries of both old and new. The shifting global landscape requires a new thinking and new solutions to deal with them. As countering weapons of mass destruction takes on a new sense of urgency, we must work not only together, but differently than we have been in the past. And as key U.S. government leaders call for a paradigm shift from the global health security and biodefense community, Booz Allen Hamilton has the opportunity to be a critical leader to the most significant national security challenges and threats of our time. Today, we will first hear directly from Dr. Asha M. George, the Executive Director for the Bipartisan Commission on Biodefense and author of these Bipartisan Commission on Biodefense reports, which are shaping key U.S. government leaders' call to action. Dr. George is a public health security professional whose research and programmatic emphasis has been practical, academic, and political. And she has served in the House of Representatives as a senior professional staffer and the subcommittee staff director at the House Committee on Homeland Security in both the 110th and 11th Congress, and has worked for a variety of organizations, government departments, foundations, and nonprofits, including the Department of Homeland Security and the Department of Health and Human Services, and has also served active duty in the U.S. Army as a military intelligence officer and paratrooper, airborne. Dr. George, we look forward to your insights and are honored to have you with us here today. So if you will please welcome Dr. George.
Thank you, General King, and esteemed guests. I'm very happy to be here at Booz Allen Hamilton. My experience with this firm began many, many years ago, and I think that's an important point to make. We have many contractors, especially in the Washington metropolitan area, but none have quite the history and experience that this particular firm does. And I think that that counts for a great deal when we're talking about these long-standing, very complicated problems that are facing the nation today. I'd like to start by talking about the biological threat itself. Many people have put the biological threat into the too hard to deal with category for many, many years. Despite the fact that for many decades, we ourselves were involved with an offensive biological weapons program. We ended that program in 1976, the offensive program, and kept up with the defensive program. And I think at the time, we thought, the nation thought, that just because we stopped, everybody else would stop too. That turned out to be an enormous mistake on our government's part, as evidenced by Russian and other defectors coming to the United States and describing in detail the biological weapons programs that continue to occur all throughout the world, not just in Russia. If we fast forward now to 2020 and look back just a little while, just a few years ago, maybe 5 to 10 years ago, if you look at what the State Department had to say about the Biological Weapons Convention when it put out its verification report, you'll see there are some years when they say a number of countries are involved and are doing something that looks like we might have biological weapons activities and programs over there, and some years when they say, well, there's nothing there and we don't know. I think the most important point about that, though, is that in the last few years, yes, we had this sort of wimpy, we don't know, we don't have enough, we're not sure statements. And I don't want to say wimpy in a disparaging way of the State Department. They simply didn't have the evidence and the intel they needed to make a more definitive statement. But I think it is important for us to realize today that the latest State Department report, which is open source from April of 2021, this year, very clearly states that Russia and North Korea have active biological weapons programs, period. They've come all the way out and said it. And in addition to that, they're looking at China and Iran, and they're not quite willing to say absolutely definitively they have programs too, but they're extremely, extremely close. Now, if you take that report and you add to it the other things that we have, like public statements by these countries, we start seeing a threat picture that we are not prepared to deal with very well, and that isn't matched by U.S. investments. So, for example, China has been very clear about how much it's willing to invest and how much it is investing. China has come out and said, in terms of their bioeconomy, they're willing to invest $20 billion over, I don't know, 3 years. I mean, it's some crazy amount of time. That's what they're willing to say in the open source. So we can only imagine how much else they're sticking in there and how much else would apply to the bioeconomy that's actually maybe considered part of some other category just for the heck of it, like cyber or data analytics, something like that. So we have a very, very serious problem with people developing biological weapons at the nation-state level. And you have to consider, you have to keep in mind that they didn't just wake up this year and say, hey, we're going to do this. If they're already to the point where the State Department and the intelligence community and the Department of Defense are willing to say, yes, this is what's here, then they've been in it for a very, very long time. Now let's add to the nation-state problem the problem with terrorists. Terrorists have been saying for many years now that they want to get a hold of biological agents and they want to get a hold of biological weapons and use them for terrorist purposes. They too are to the point where they're posting on the internet actual directions on what they think terrorists in their organizations, in their distributed organizations should do, should they be able to get a hold of biological agents and biological weapons containing those agents. Out on the internet, not necessarily in Arabic or somebody else's language, but in our language. This is of huge concern, but it is even more concerning right now, considering both the Taliban and Al-Qaeda have mentioned this, this determination and this desire to get a hold of these kinds of weapons. And they're taking advantage of the new resources they've gained, having taken Afghanistan back, and also elsewhere in the world. It's not as if they're shrinking in size. They're growing in size and getting more and more resources in their hands. BT, these are things, they are resource intensive, but it's not impossible anymore. You don't need, as General King and I were discussing earlier today, you don't have to have a BSL-4 laboratory to start working with this stuff. And you certainly don't need to go into a laboratory or a secure facility to get a hold of the biological agents themselves. Many of these things, anthrax, Ebola, tularemia, brucella, plague, all these things, they're out in the environment. Is it easy to just scrape it up off the dirt and throw it into an envelope and expect that if somebody opened it, they would get sick from it? No, it doesn't quite work that way, but we're not that far from it. So that's the intentional threat. We also have the threat that comes to us from accidents and naturally occurring diseases. When I talk about accidents, for the most part, we're talking about unintentional laboratory releases. I think there's a tendency in our country, because we're so advanced scientifically and we do take so much care, starting from when we're in elementary school and junior high and taking science in laboratories. In school, we're taught to be clean. We're taught to use alcohol. We're taught to disinfect as much as we possibly can. But even so, we get to the high-level laboratories here in our country, and they, despite their care, do slip up every once in a while. We saw it when Dugway accidentally shipped out for many, many months impartially inactivated anthrax throughout the nation and outside of the nation. We saw it with the Centers for Disease Control and Prevention when somebody noticed that they had put high-level biological agents that should have been in a BSL-4 laboratory in a cabinet in a hallway somewhere and unlocked. We saw it with USDA trying to go around and help other facilities at the state and local level inspect and make sure that they were okay, and not actually conducting those inspections in an appropriate manner, resulting in us not knowing, for example, at Tulane University, that there were organisms escaping from a laboratory that went on to infect a giant group of monkeys in a hospital enclosure there on the university, and so forth. I mean, I'm not trying to rag on the United States government, simply to say that even at that high level, we have issues and accidents occur, and it's just part of our threat landscape here in the United States and, of course, throughout the world. That leaves us with naturally occurring diseases. I don't think I need to lecture this audience or anybody in the entire world at this point about the importance of paying attention to naturally occurring diseases. COVID-19 is still with us. COVID-19 is continuing to mutate. COVID-19 has not left. We feel like we're turning the corner, but I think much of that is because we really want to turn the corner, not because we actually have turned the corner on the disease. We still have too much of it out there. The very fact that we still have people dying from this disease to the high numbers that we have every single week, every single month, the very fact that we have hospitals that are still dying under the strain of trying to be able to save people, to keep their ICUs from running over with people who have COVID, just tells us that we're just still in the middle of it. And we can see what's happening throughout the world. I can tell you that my family, extended family in India, is still on total and complete lockdown. They can't leave their houses for any reason. And if they do, the police are right on top of them. What are you doing? Where are you going? Why? Why are you even outside at all? They're just trying to save lives. That is a pretty big nation. And I think it's important for us to take into consideration that large countries like that, with large populations that are not performing the way we want them to, are one of the reasons that we're having trouble with our supply chain. We get a lot of pharmaceuticals from India. We should all recall what happened when Puerto Rico was hit with that terrible hurricane a few years ago. What happened? We lost a lot of our generic pharmaceutical capability and capacity because it's a lot of it is down there in Puerto Rico. So when we're looking at the naturally occurring disease picture, obviously there's so much going on all throughout the world, all different kinds of diseases. And I know it seems like it's just too much. We just, we need to leave that to the healthcare and the public health people and just leave it alone. But we cannot. Infectious diseases that rise to the point or spread to the point that they affect our national security, make them something that we have to pay attention to, whether we want to or not. And we cannot relegate national security issues to healthcare and public health institutions that have a whole lot of things to address, not just this, and who do not have the resources or the capabilities or the capacities necessary to fight a national security threat all by themselves. This is what happened with HHS. This is what happened when HHS was sort of told to, hey, sort of handle this COVID thing on your own, and the rest of the federal government's just going to stand back and, let us know if you need anything. Well, they got to a point where they were completely overwhelmed, the way we see states and localities and tribes and territories get overwhelmed. And in that moment, at that point in time, what happened? We saw FEMA had to come in, DOD had to come in, and the rest of the federal government had to stand up and pitch in. Not that that's terrible, and not that we don't know how to do that, but I think we can all agree that had we been paying greater attention to this naturally occurring event, we probably would have activated a lot of that sooner, or at least we could have. I would rather us have stood a bunch of departments and agencies up and a lot of processes that have to do with the private sector as well, and then said, hey, you know what, not quite as bad as we thought it was going to be. Let's stand that stuff down. It's not as if the Department of Defense isn't used to doing that. It's not as if the intelligence community isn't used to doing that. I think we have to get the entire government and the private sector used to doing just that. So that's where we are, I believe, and that the Commission believes, with the biological threat in terms of the picture. In terms of what we can and should be doing about it, General King mentioned one of our reports, the Apollo Program for Biodefense. We believe, and I will tell you, this is a big, high top priority of Senator Joe Lieberman, who is one of our co-chairs of the Bipartisan Commission on Biodefense. It's one of his big priorities. He wants to see it happen. We need a whole of society effort to take pandemics off the table. We believe it can be done in 10 years. We believe it needs to be done with $10 billion a year every year for 10 years. But $10 billion is not a whole lot when you look at the entire budget. And more importantly, it's not a whole lot when you're looking at how much we have lost in terms of our economy just due to COVID, not to mention everything else that's affecting the economy when it comes to diseases. It's not that big of an investment. But let's talk a little bit about what it requires. It is not something that can be delegated to one department or agency. It requires the entire federal government to be involved. But if you look back at the lunar Apollo program, it took some other things as well. The President of the United States, and actually I should say plural, presidents, need to think it's a top priority, come out publicly and say it's a top priority, and push it, and be willing to go talk to Congress and whoever else to say, hey, this is a priority for the nation, number one. Number two, it requires usually somebody else in the White House, the Vice President, for example, also staying on top of it, because the President doesn't, the President has a million things to do. You need somebody else to come in and be keeping an eye on it. And remember that the Vice President has an interesting role as being also the chair of the Senate, the president of the Senate. There's a connection there that doesn't always get exercised, but probably should. And is getting exercised right now with Vice President Harris, and was previously with Vice President Pence as well. It helps that they had that previous congressional experience. In addition, though, we also need academia to get involved. We need states and localities to be involved. And given where we are today, we need the contracting community to be involved as well. If you look at what happened with the Lunar Apollo Program for Biodefense, if you look at what happened with the Manhattan Project for, not biodefense, for nuclear development, you'll see the contractors were critically important. Some of it was just about management. You know, somebody's got to manage the contracts and manage the people. And some of it was not that at all. Some of it was about understanding the totality of what was going on, being in charge of making sure that all the bits and pieces and parts that a project manager, that a program manager would need to keep track of were being kept track of and communicated back to the federal government, to the White House, to whoever was in charge. It is impossible to engage in a national effort, and actually an international effort when it came to some of these grand challenges, without contractor support. Now, I will say that I'm a little bit biased because what General King did not mention is I worked for a lot of contractors in the past, and so I'm pro-contractor. But these are the facts. If you look at the history, you will see there were contractors that were there. Not thousands of contractors, a few contractors with many, many capabilities that they could bring to bear to help make this sort of thing a reality. In addition to the Apollo program for biodefense report that I mentioned, the Bipartisan Commission on Biodefense has actually put out a number of other reports as well. General King mentioned the Biodefense in Crisis report we put out. That is actually a status report that has to do with our National Blueprint for Biodefense. That report came out in 2015, and it contains 33 recommendations that addresses the entire spectrum of biodefense. So not just healthcare and public health and maybe a little DOD thrown in there. No, we go from prevention and deterrence all the way through preparedness and detection, response, attribution, recovery, and mitigation. It's a whole of government thing. The Department of Defense, the Department of State, the Department of Health and Human Services, USDA, these are all the normal departments that you think would have something to do with biodefense. But in fact, I will tell you that every cabinet level department, or every department, period, has some responsibilities for biodefense, every single one of them. A number of the independent agencies do as well. I simply mention this because Biodefense in Crisis is a report that's unnecessarily fat. I mean, it's huge. And the reason is there is so much that's going on and so much that's not, and that still needs to happen. I would recommend that you take a look if you want that snapshot in time. It's not going to last forever. We put it out this year, and you know how fast things are moving right now. But take a look at it. It'll give you a good snapshot of where we stand. In addition to Biodefense in Crisis, however, I just want to, I'm not here to hawk our report so much as simply to tell you that there's so many aspects of this problem. It is truly a multifaceted problem. We have put out reports on agro-defense. This year, in addition to the Apollo program report and Biodefense in Crisis, we also put out a report on biodefense of critical infrastructure, in which we address every single one of our 16 critical infrastructure sectors and provide recommendations that are tailored specific to them, as well as a report on BioWatch, which I have to tell you is still problematic, but that we are convinced is a problem that can be solved. We already have the technology to solve it, to at least get us off of square one, which is where we still are after 18 years. We put out other reports as well, state and local capacity, response capacity reports, something on budgeting for biodefense and budget reform specifically, and so forth. You can find them all at our website. But I recommend that you take a look at them, even if it's just a quick look, even if it's just to look at the executive summary, because I think when you're trying to decide here at Booz Allen and elsewhere in the contracting community what you want to do and where there are opportunities to bring the strengths of an organization like this to bear, it's not impossible to figure out It's not that there isn't anything out there. You can see where the opportunities exist, and you can see where we, as the commission, are pushing. I think I'll close here by just giving you a little information about the commission. I probably should have done that up front. Sorry, William. The Bipartisan Commission on Biodefense is a private sector commission. It is funded by the private sector, but we run ourselves like a congressional commission. And one of the reasons we do that is because our co-chairs and commissioners are almost all former Congresspeople. So our co-chairs are former Senator Joe Lieberman and former Secretary of Homeland Security and former Representative Tom Ridge. And we have 4 commissioners, former Senator Tom Daschle, former Senate Majority Leader Tom Daschle, who, as some or most of you know, was the recipient of one of the anthrax letters back in 2001. Former Secretary of Health and Human Services and former Representative Donna Shalala, former Representative Jim Greenwood, and former Homeland Security Advisor Ken Weinstein. We also had, for a short while, we had Lisa Monaco, who is also a former Homeland Security Advisor and who is now the Deputy Attorney General of the United States. So we run our meetings all day like they're all-day hearings. We get information from those hearings. We also conduct additional research. We know a lot about what's already going on in the federal government, and we put all that together and produce reports. But I will tell you, one of the differences between our reports and I think everybody else's reports is that our recommendations are written in incredible specificity and are designed to be picked up by Congress and the White House. And if you look at how many of our recommendations have been picked up, you'll see many of them have. Our third recommendation from the National Blueprint for Biodefense was for a national biodefense strategy. That was put into the National Defense Authorization Act by Congress. It was signed into law by President Obama, and it was produced by the Trump administration. And as General King mentioned earlier, the current administration, the Biden administration, is setting about completing the implementation plan for that strategy, because a strategy without an implementation plan is a very nice document to stick up on a shelf. We all know that. We have had a number of our recommendations put into law as well, but even beyond that, they've been taken up by the federal government. I mention this because we have a tendency sometimes to view the federal government as an adversarial entity that doesn't really want to do the right thing or doesn't know how to do the right thing. I think they absolutely do know what the problems are. I think they really want to solve the issues that are facing the nation today, but they need some help. They need help because they cannot possibly stay on top of every little thing that they need to in order to address these problems. They need the help of the contracting community. They need the help of the academic community. They need the help of industry in general. They need the help of states and localities and tribes and territories, and they need the help of the international community. I think COVID-19 shows us as a pandemic that we really are just one big world. And there are some people we work with a little bit better than others, but regardless, we're all in it together. I think it's critical, it is absolutely critical that the contracting community understand this, understand their place in biodefense, and feel very free to step up and step up your own game to get more involved. I think that the opportunities here are huge to make an enormous impact on our national security and get the country from where it's been sort of stumbling over things with COVID to where it's been surprised that some of these nation states are now absolutely involved in biological weapons programs, to the place where we're doing some things in advance or at least concurrently with the threats that are facing us today. I don't want to see it ever happen again that after the fact, months and months after the fact, someone says, hey, China is a closed country. how are we going to get in there and find out what's going on? We need a little bit more information. And then someone says, oh, why don't we ask the intelligence community to go in? Or why don't we ask the Department of Defense to go in? We don't need to be there. But we too often find ourselves exactly there when the federal government is in full-on response mode and isn't thinking beyond what's right in front of their faces. I think that is one of the prime responsibilities of the contracting community, and it is certainly a responsibility, I think, of Booz Allen Hamilton. So with that, I think I'll close with my remarks.
Dr. George, thank you, and thank you for sharing your insights and observations with us and with this audience, both in person and distributively. And so now we'll welcome a panel of our Booz Allen leaders to the stage for the second half of this webinar. And it's to drive discussion on how Booz Allen can improve biodefense readiness and better support the Countering Weapons of Mass Destruction mission set. And for our audience, we look forward to your feedback, comments, and questions as well. Following today's event, we will also provide information to all participants on future opportunities to get involved with this mission set you should hear discussed today. And by the end of our time today, we hope you feel inspired by the future of biodefense. We're very passionate about it on how Booz Allen community can support this mission set and transform, and our goal is to recruit your talent, contributions, and service in this mission. So today, from our Booz Allen senior leadership, we have Ms. Judy Dotson. Judy is an executive vice president of Booz Allen Hamilton, serving on the firm's leadership team, as well as leading the firm's national security business in support of the critical missions of our country's intelligence communities. Judy provides strategic leadership across 3 major markets that comprise the firm's national security business, both the defense, military intelligence, and space, cyber, and our national agencies. Together with the National Security Group Client Service Office, Judy strengthens the firm's position at the intersection of longstanding and deep mission understanding with the infusion of emerging technologies for national security. Next, we have Ms. Leslie DeFonso, and she is also an executive vice president at Booz Allen Hamilton, and Leslie is a leader in the firm's Joint Combatant Commands business, helping clients use innovative solutions to transform their environments to meet mission objectives. Leslie has more than 25 years' experience in technology service and business strategy across civil, defense, and commercial organizations. We also have Mr. Steve Estravage, the Senior Vice President at Booz Allen Hamilton, and Steve leads the Booz Allen's analytic practice and artificial intelligence services business, serving clients across defense, civil, and intelligence sectors. And as a leader in the firm's strategic innovation group, Steve also leads the firm's investments in data sciences, machine learning, and AI. Next, we have Mr. Greg Wenzel, Executive Vice President at Booz Allen Hamilton, and Greg leads Booz Allen's Army business. And his primary focus is to help the Army transform and modernize by bringing the best digital, analytic, cyber, and engineering capabilities available to our warfighters. Mr. Wenzel has a deep understanding of the Department of Defense C5 ISR, and yes, that number keeps going, mission areas and enterprise integration, leveraging both API design and management. He is a specialist in distributed computing solutions and has deep experience in intelligence community, tactical warfighting, and commercial web-based systems, as well as advanced distributed simulations. And lastly but not least is our Chief Medical Officer, Dr. Kevin Vigilante, and he is an Executive Vice President as well at Booz Allen Hamilton. He's a leader in Booz Allen's health business, advising government healthcare clients at the Departments of Health and Human Services, Veterans Affairs, and Military Health System. And he currently leads a portfolio of work at the Department of Veterans Affairs. So with that as a backdrop of our panel, let's get on to the discussion. And our first question to sort of kick it off, Dr. George, you set the stage for this biodefense in crisis and where we need to be going in the Apollo report. And I like the way that the commission has actually set up a website with all of the recommendations and a status of where they are being implemented. What do you think are the obstacles from the current administration fully implementing it and making this a reality?
Well, of course, the current administration, as was the previous administration, but the current administration is caught up in trying to deal with COVID-19 and all the problems that have resulted as a result of COVID-19, and all the other things that are going on in the world. But let's be honest about that. That's always the case, right? There's always something that's going on in the nation. I think it's a question. It always comes down to leadership. You know, some of us are former military, and we know that's what it comes down to. Leadership and vision are what are required. It's hard to exert leadership and vision when you're in the midst of a response. It's so easy to just dive in and stay in that space. I think the biggest obstacle then is simply that. And in order to overcome that, the current administration is going to extricate itself to some extent. Have some folks who stay outside of it and take a bigger picture view, not just of biodefense, but of what's happening throughout the country and throughout the world, and where the country finds itself in terms of positioning. And then, understanding that, make biodefense a top priority. Our commission made a recommendation in 2015 that the Vice President of the United States be put in charge of biodefense, from a very practical aspect, and that was simply because if you have that many departments and agencies in charge of various parts of biodefense, you can't put one of them in charge of all the rest and say, you know, everybody follow what this one department has to say. I don't think it's even legal. They can't actually tell another department or agency what to do, with the exception of DOD on occasion and maybe FEMA on occasion, but otherwise it's not possible. And it certainly isn't possible with HHS being in charge and trying to tell everybody else what to do. When we put out biodefense in crisis, we actually modified that recommendation a bit. We understand that the Vice President has many, many roles and doesn't have that much staff, respectively. The NSC has to be very closely tied to that leadership requirement. So we recommended the creation of a Deputy National Security Advisor specific to biodefense, and to have that person work closely with or under the supervision of not just the National Security Advisor, but also the Vice President. It's important. What the Vice President takes on, and usually the Vice President doesn't take that many projects on, if you look historically, but when they take something on, they have the imprimatur of the President, and they're meeting with the President quite frequently about their priorities. It would automatically make biodefense more of an issue that stays in the mind of the President of the United States and the National Security Advisor, regardless of everything else that's going on.
It's often said the United States likes to talk about deliberate planning efforts to plan and prepare for the next major crisis, but it strives in crisis of reacting to the crisis at hand. Mm-hmm. And sometimes we get short attention spans and diverted to the next effort. Dr. Vigilante, you've often talked about mission integration and efforts we tried doing back with the Ebola crisis of 2014-15.
Yeah.
What do you think's keeping that mission integration from being?
Well, it's related to what Dr. George was just talking about. A great talk, by the way, really.
Thank you.
And great report. I read it cover to cover. Really well done. And I think this is part of the same problem. If you have 19 federal agencies responsible for these responses, I mean, in a sense, nobody's really responsible. And there are budget issues, turf issues, career issues, promotion issues, authorities, all these things that conspire to create a fragmented response. And we had this concept of mission integration where you would actually sort of coalesce around a mission and have shared responsibilities. Even talked about things like creating a Goldwater-Nichols legislation for jointness that included civilian agencies for these kinds of responses. And I think that this really gets to, back to who's going to lead it, who's going to be the single voice, who's going to be the authority. And I'm just curious, I think your recommendation is a good one. The question is, does that office, have the authorities to actually tell what agencies have to do, and has that been picked up and sort of embraced? Because I do think that is, of all the things that need to be done, I think is among the most important. So The question is, where would we play in that role? I mean, just one last point. We do great when we have one client that we have a relationship at the senior level, whether it's a secretary or an administrator, a senior administrator, and we could be a trusted advisor and help them see what they ought to do. Well, you have 19 federal agencies. It's really hard for a contractor, for us, anybody, to come in and sort of help them find a way forward collectively. And I think that's a lot of the crux of the problem, but I just hear you, or anybody's thoughts on that.
I would agree with what you're saying, and also with what you just said, Dr. George, about leadership. Leadership is essential, but the reason we need the leadership is so that we can execute in a focused way. I mean, think about it even within the halls of Booz Allen, right? When we think about how do we grow, how do we serve our clients, how are we going to accomplish, we can't all be out for a pass doing whatever it is that we want to do. We need to align and go, and that means an implementation plan, as William talked about. That means that we know the straight line to get there and what there is. And I think in the absence of defining the overall operating model, everyone's going to do their best, but it's going to be their night job, because it isn't like anybody's sitting around without enough to do in our federal government.
Right.
We really need, particularly the people that we want to be involved in this particular initiative, we would want them to be some of the best thinkers, some of the best leaders, and they probably already have multiple jobs. So that's something, it needs to be a priority for them.
Yeah. The synchronization and coordination across multiple agencies, I think, is where we shine, because we understand the mission sets. We're doing it today, but also coupled with our knowledge of the mission, the technology to enable what needs to get done is absolutely critical. I believe it's all about the data, power of the data, and getting hold of the data sets to do what we need to do in areas of machine learning and AI.
Mr. Escovage, that's a great transition. We were talking about this hypothesis that we should focus on data platforms, and the analytics to create a common operational picture so that these agencies truly have a whole of government, whole of society view on it. What are your thoughts? Are we capable of doing that today that maybe we couldn't have done 5 years ago?
Well, I think we could be optimistic about what we could create. I look at data science and talk a lot about artificial intelligence these days, and I tend to be more optimistic about it. The technologies are not the limiting factor. It's our ability to come together, agree on policy, agree on governance that we could use. But I think you have to look at these technologies from both sides of the coin. One side is we could increase our ability to detect emerging threats. We could build better surveillance systems. We could optimize responses by agreeing on data standards and solutions in that space. But as we saw in, ironically, the National Security Commission report on artificial intelligence, it also talked about additional threats that could come from the use of these new technologies, where folks that don't have the same moral, ethical standards that we do could use these technologies to build new threats, use them to optimize pathogens, use them to come up with entire new ways of detecting weakness in sort of our biosurveillance solutions, which, again, I think on our side, we need to build towards the positive, the upside, the optimistic outcomes. We also need to educate what we can understand about new potential threats that could come.
Can I just sort of build on that a little bit? You know, I think there's the sort of, as you said, the data and the data strategy, but, you know, one of the challenges is, as you alluded to before, is bringing these 19 federal agencies together. And it's hard to bring people together sort of in an abstraction, you know, before an event. And I'm just wondering, and it's not that this would be easy, but does the data provide an opportunity to think about something to come together about? That almost be the centerpiece of the campaign, where you're saying, okay, really the very first thing we're going to do is share a common data platform, even if it's a federated data platform, where where the agencies can start sharing data in a common space to create a common operating picture. Now, we know how hard it is for people to, they don't like to, but that's part of diplomacy and the statesmanship that comes with building collaboration and the MOUs and the agreements. And that's something where I think, you know, for us, is, you know, might be a place to focus, given our expertise in that area and our relationships across the government, maybe that piece of it could be actually a catalyst that starts to drive the kind of collaboration and cooperation at some, not starting from the sort of in the middle, but both top down and bottom up. I don't know what others think, but
Kevin, I love your idea and vision. The classic, we should probably look at what are the obstacles to get there. I was wondering why I was invited to this esteemed panel of colleagues, because I'm on the defense side, but we've been hampered by that problem for the better part of 2 decades.
Yeah.
How do we network our force to go after the bad guys? Now, when we were in a counterinsurgency, it was a little bit easier because we had access to wherever we wanted to go because we were the big person, big country on the block. We could barge our way in. But now going forward, there's this thing called Joint All-Domain Command and Control, JADC2 on the DoD side. And as you guys are talking, and Dr. George, when you were explaining, I'm like, it's a parallel issue. AKA, how do we network and connect? And it would be great to have this centralized data platform that we could all use. But the thing, just being an engineer, and I love to build things and get it out there, what I'm finding, the problem is not the tech, as Steve said, it's the social engineering and policy.
Yeah.
And if we don't change something there, I love the idea around vice president in charge of whatever. We're trying to find who is in charge of JADC2 and networking, because each one of the services and agencies fight for budget and basically, I don't want to depress everybody to include myself further, but I go, you said something interesting, in your country, India, where, people would be stay inside. How would that go over in the U.S.? In our adversary countries,
Well,
some
we already
cases,
tried it. It didn't work out.
Right. OSHA and freedom of this, and this is what I'm actually really tracking is, the greatest benefit that we had, freedom of speech, freedom of a lot of things, we are basically an unconformist society. Innovation, greatness, sorry Leslie, but that's how we became the technology advance, but it also is a hindrance to us being able to converge. And something has to change at the most top, change some rules, remove some laws, adjust some laws to allow some hybrid. We don't want to be an autocratic society. We don't want to be like our near peers, but we got to figure out a way to come together a little bit more. Or otherwise, we wouldn't be able to realize your vision, Kevin. They'll be like, yeah, you're not touching. You got to give me a presidential order that says I got to do it, otherwise I'm not doing it.
To credit the government, though, they've already rolled out Advana, which is an open data platform for data analytics, and it's been successful. So it's technology owned by the government, but it's truly been those in the government that are working across agencies to gather the data to explain, basically from a social and cultural perspective, they have succeeded.
Yeah.
We continue to do things in different mission areas, but there's no reason why you couldn't expand the mission areas to some of the objectives you're trying to achieve.
yeah.
Well, and I have to say, it's going to take something like this, a new platform entirely and a new approach that comes from a different department. Right now, there is a requirement for the National Biosurveillance Integration System, or Center, at DHS. But DHS has tried for at least 10 years that I'm aware of, if not longer, to get the other federal departments and agencies to provide their data, and they simply either won't do it or can't do it. So I think they're still limping along with like 3 partial data streams. That's not getting us anywhere. And now they're beginning to, because DHS does have authority to go off into the open source space, they're trying to get a bunch of stuff from the open source, but then that puts them into a position to try and compete with like Google, which is crazy, right? It's not the way to go, and it's certainly not the way to go with federal data streams. So somebody mentioned earlier, maybe it was you, General, that we might need a federated data system to start. I would recommend that if somebody were asking me. Yes, there's a whole bunch of stuff out there in the private sector, but much of what we're talking about when it comes at least to the healthcare and public health side has to come up from the private sector anyway, and is already going into various places within HHS. Same thing on the USDA side. Perhaps that's the place to start. I would, though, definitely recommend starting again. Like, let's jump over the old technology and the old requirements and start again with something like Advana, or if there's something else that's out there. And I know that we all try not to depend too much on the Department of Defense. But if there's already a model that's working at the Department of Defense, at the very least, that should be and could be shared with the rest of the federal government to get something moving again.
If I could just I'm sorry, did somebody else want to? No, okay.
No.
So this idea that the Department of Defense is a special role, I think, when was the Defense Production Act written? I mean it's got to be 30, 40 years ago. I mean, a long time ago. And I just think, watching what the Defense Department did with Operation Warp Speed and, stepping into a void here, it's pretty extraordinary, actually. And I think, Leslie made an interesting observation about Advana. I mean, I've watched Advana grow. I mean, it started out as a data lake, for the comptroller to do sort of manage, consolidate thousands of financial databases. But during the pandemic, it grew to, supply chain data, COVID modeling, public health data, readiness data, where they were all able to consolidate that data and really develop a common operating picture that you couldn't do with fragments of that. And so it really showed the potential of that. And I think that, it has a unique place in our society, Department of Defense. And, and thinking about the Advana platform to FEMA or CDC or, other, it's an interesting concept to think about that, to coalesce around that. So just a thought, but certainly one worth exploring, I think.
I think it's a real opportunity to find the pockets of excellence across the government, right? There's Advana. We know the intel community's mission is to collect, to analyze, and disseminate data. So at its core, that is what we do across the intelligence community. And we are involved in a job right now where we are working from a biothreat perspective, pulling together the data and starting to use it. Now, when you've met a biothreat, you've met one biothreat, right? So we'd have to take a look and make sure that the data, see how broad the threat data is. It's being collected. But I know some of the folks that are watching helped us on that proposal. Leslie and Todd's team helped us. Steve's team helped us. So we brought together all of Booz Allen to go after that. And I'm hopeful that that's a great way to begin to collect the data, and then you put that in something like Advana, and you can visualize it, right? You put Steve on top of it, driving AI solutions, and all of a sudden you're predicting what's next. I mean, that's pretty cool, and that's how I think we need to look across the government.
Yeah. So I'm wondering on the thread, so I'll come into the happy place now and join it, because I'm sure there's folks on the line that are like, everybody's happy, it's not that way, but your good point, Advana did happen. And it's almost like, how did that really occur? What were the ingredients of the leadership? We partnered with the government, but there's something there that, make that visible that says, we believe in some of these joint things, and it needs to be a government-owned open architecture that everybody plugs into. Whatever your APIs are, if you're a technologist, it's like the government defined, that's what the path we're trying to take on JADC2, but is it in the leadership? Is it in the architecture of how? But somehow that client got people starting with comptroller data or whatever. There was a need that people were like, I'm not going to fight this. I need to plug in for an enterprise benefit for all of us. And if there's a way to, I don't mean to put you on spot, Leslie.
Technology is the enabler, but I attribute the success of Advana to the leadership of those in the government. And their ability to, and it's all about getting the data sets and pulling in others to get the proper data sets, to get the right combinations of data, to do the analysis, to support decision making. And they were able to do that. And I think that is one of the biggest challenges. I think you can always have the technologies in support of that, but you need the data as part of it, that I think is the heart of it.
Historically, it's always been about authorities and policy associated with ownership of the data. And what Advana does is it creates data sharing agreements where it never takes ownership away from the originator who owns the data set. It allows access to query that data and incorporate it with other analytical efforts with other data sets. So literally, that's the breakthrough. We've gotten over this idea that I don't need to own your data. I just need to be able to access your data and query your data along with all of these other data sets to be able to get where we're going. Yeah. Dr. George, if you don't mind, I'll transition. One question is, compared to other national security threats like nuclear and cyber and infrastructure, et cetera, biodefense has long been under-resourced or episodic in its resources. In other words, we have a crisis. We've had 11 pandemics since 1900. We have an extreme crisis, we react to it, and as soon as we stop the deaths, it sort of passes our attention span and we go on to something else. How do you see this call for investment as competing with other national security priorities? And if it is, how do we make biodefense a sustainable, deliberate effort instead of always reacting to crisis?
Sure. So it's absolutely competing with everything else. That's life, that's the way it is. It's the way it is here in this country. But that's just the reality of it. What I hope is that given the pandemic and given what we're hearing now about these renewed nation-state biological weapons programs, that there's no choice. The government simply has to make it a higher priority, especially when we consider that even if we didn't think it was a big deal, and even if we were willing to relax and say, well, as soon as we get over COVID, that's sort of the end of it, we have to understand now that we are losing our competitive edge. With China investing billions like this in the bioeconomy, the very first thing we expected, and I'm sure the intelligence community saw in like 30 seconds, was that Russia raised an eyebrow and said, no, we're not letting that happen without us doing something in response. I personally think that Vladimir Putin walked through the halls of the old biological weapons laboratories himself and flipped on the lights, because they just never really shut them down entirely, or if they did, they turned them right back on. But that's not enough. It's not just about BW. Now Russia is in the game, investing, trying to compete with China, as one would expect. If we thought that this was happening in Mexico or Canada, we too would be saying, hey, we need to get more competitive, we have to put in more money. Now we have two gigantic nations in the world that we worry about from a security perspective making these investments. We have to do so as well. I think it's a question of taking bio out of the episodic sort of approach to disease events and saying it's not that now. There's so many aspects about this that include that, but are also that also transcend just the occasional outbreak, epidemic, or pandemic. If we have a bioeconomy issue, we have a nation-state warfare issue, we have terrorism involved now, and our own economy is so tied to what's happening with COVID in and of itself. It would be ridiculous for us to say, okay, well, we're over this now, and that's some other administration's issue. We can't do it anymore. I think that's what it takes. But it's going to need, but it means accepting that. And I'm not sure yet. I think the administration has accepted that. I don't know that Congress has. And it's not enough to say, well, the White House thinks this is a good idea, as we've seen time and time again. Congress is going to have to come on board too. The challenge for them, Congress has the power of the purse, and they're back down to trying to figure out what are we doing with limited dollars. It's a challenge for them, but I am hopeful that they understand what's at stake.
But I think it also goes back to your discussion about mission integration and someone in charge. I think without a dedicated director of biosecurity that's leading the advocacy for our nation back to our Congress, what Congress is going to see is 19 each coming in and asking for part of the pie, and there's no integration, synchronization.
I totally agree with you, and it has to be, whoever that person is at the White House, if it's up at the White House, that person has to understand Congress. It cannot be, there's some positions in the government, some political appointees, whether we're going to make this political or not, I don't know, but that absolutely require somebody who understands how the White House works and who understands how Congress works and who understands how the private sector works. You cannot put somebody in there, no matter how dedicated they were during the campaign, and just say, here, you become the director for biosecurity. They're not going to be able to do it. They're not going to be able to go over and make those arguments to Congress. They're also not going to be able to stand toe-to-toe with OMB, which is the other factor in all of this. They should know what's going on, and they have a role in integration as well.
I know we're at the end of our time, but just one last observation on this, right? I mean, many crises often bring us closer together. It has not been lost on our adversaries, I'm sure, that this particular crisis has driven us further apart. And it would seem that for those who are really trying to injure us in a significant way, they've observed that this kind of warfare and attack is a very potent way, not just to bring us down in numbers and casualties, but in our sense, our cohesiveness as a country. It's a real vulnerability I think will be attractive to any adversary, and I think we'll see more of this for that reason.
I'll offer the whole group for your thoughts one last question.
Yeah.
Some would say the greatest lesson learned or observation from the COVID response is our lack of consistent, reliable strategic communications. And we'd say that there's lots of fear, naturally, around the WMD, weapons of mass destruction threat, which makes it a prime area for disinformation operations. I'd offer you, should we take a greater advantage of technology and near real-time situational awareness to counter disinformation and to create a consistent, reliable, strategic communications message so that the whole of society is informed and engaged and brought into the solution? And I'll ask anyone on the panel. Mr. Wenzel, I know this is one of your areas in the Army especially.
Yes. The issue, I mean, everybody knows, and Dr. George is like, we don't want to make it politicized, but the COVID thing became politicized.
Right.
And so how do you actually, and you're hearing all the things around Facebook and whatnot, it's like, how do you get to the center line, the ground truth of information? That will be, but I would agree, yes, that needs to be, it's like, here is you call it the common operating picture or the portal of truth. This is authoritative. This is no lies, no politicize. It would be great. I'm just curious if it's altruism. Could we ever get there? But yeah. I'm in.
Of course it would be great. The problem is, people say follow the science. Well, sometimes the science is very clear, and sometimes it's not. And you still have to make decisions with inadequate information. And when you make these decisions, even where the science is clear, you're making usually policy decisions, which are judgments, which you're weighing pros and cons of. And to say that that's a black and white is probably way oversimplifying the choices that are going to be made. And so yes, while there's misinformation, there's also because people have different risk appetites. And we see it all the time. That's why you have different investment portfolios. Why some people, ride motorcycles and others don't. I mean, and so these judgments, it's just following the science and the facts is actually not, it's yes, necessary, but not sufficient, because there is going to be a lot of judgment here when you're in the realm of public health, public policy, and these types of things, and you're going to have different opinions.
Yeah, I'll say one final thing about that is there's always, as long as we've been communicating, there's always been disinformation. I think there's an intent today to do it at a scale and to weaponize it that maybe we haven't traditionally seen, but maybe we have. I think the most important thing as I look from a data science analytical perspective is there's just going to continue to be more data that's made available. And so thinking about where we get our information from, the veracity of that source, this is going to become as important as searching for information is today. There's a great website, howstuffworks.com was one of my favorite websites. We're all going to need to figure out what are those channels that we trust and work together to build sort of community around those platforms. And the ones that we don't, we're going to have to work together to make sure that they're limited in their ability to influence.
So I'm probably not going to answer the question. I'm going to say something else. So I listened to a podcast this weekend, and I thought it was interesting. It talked about how in our society today we have anger And then layered on top of that anger, we have disgust.
Yeah.
Doesn't matter which side you're on.
Yeah.
It's anger and disgust, and anger and disgust. And what that breeds is contempt. Yeah. And we as a society are addicted to contempt. Yeah. We think it's kind of fun. Mm-hmm. We think it's kind of interesting. We choose to watch news programs that fill us with it, right? And until we can stop that chain, break that cycle, I struggle to know how we're going to have any conversation that doesn't go like this. So I just feel like that's something we need to label it, we need to know what it is, and we need to figure out how can we fix that. But this is important. This is an important reason to fix it, because who could argue with the need for us to be safe from biothreats?
Yep.
And I agree. I would say what Craig said, yes, but this is not, this is a difficult challenge. And how to fix that, it needs to be fixed, but that's a big undertaking. But it's something I agree with what Judy said, it needs to be labeled. And, with what we talked about here today, maybe that's the facilitator for it.
Yeah, and I just think, look, I'm a former intelligence officer as well as a public health person, and deal with data and things that look like data but aren't actually data quite a bit. And what I would say is this: I think that one of the big problems we had and have during COVID is that there is oftentimes a kernel of truth surrounded by a bunch of garbage. And it's that kernel of truth that people are hanging on to, and that's why they're arguing as tough as they are, because they know that one piece is actually true, and they're just kind of assuming that the rest of it is. So I think we have to identify that piece, those kernels, and say those pieces are all true. That's great. All the rest of this stuff is not true. It's like a tumor surrounding this core. We have to be able to cut through that. But I also think that there is a role for a truly dynamic communicator to get involved in all of this.
Yes.
We don't generally say that is a requirement for the CDC director. And we saw what happened when we didn't have somebody who was a dynamic communicator in as the CDC director at the beginning of this pandemic. In fact, I don't think we make being a dynamic communicator a requirement for any position in the government, except for maybe the presidency, and that's because you have to get out on television and debate and do that sort of thing. I know it sounds crazy, and I know it sounds like, I don't want to belittle what we're talking about here, but I really think that that's important. If you want people to believe what you're saying, then A, you have to figure out what the truth is and be telling them that. B, I think you have to tell them this is what we know right now. Science is still developing, everything is still developing. And then C, you have to be able to deliver it in such a way that it is believable and that people even want to listen to you. You could have all the truth of the whole wide world, but if you're a terrible speaker and you don't engender trust and you have no charisma, it's not going to happen. So I think that's just a really practical recommendation I would make.
Great words to end this by. We have to tell what we know, what we don't know, and what we're doing about closing the lack of knowledge of what we don't know. And I think being honest and open to the public, I think the public will embrace it instead of filling in the blanks where they can. I want to thank the panel for this absolutely wonderful discussion. This is all I expected and much, much more. So thank you for taking time out of your very busy days to come together with us. Dr. George, thank you for sharing your time and expertise. You truly added value and stirred the pot some more. It is an elephant. It truly is a momentous thing we have to do. And we may not have a solution to solve it all today, but if each and every one of us take a little bit of a bite, a little bit of positive action today, collectively over time, we'll be much, much better off tomorrow, next week, next year than we are today, instead of just observing the problem. You've given us a lot to think about in this time and in this mission space. And for those joining us virtually, thank you for sharing your time, and we hope that you felt inspired by today's discussions on the future of biodefense. And for those of you who would like to continue the conversation and share your thoughts, questions, and learn more, get involved, and please write us at cwmdfutures@ba.com. We hope you'll join us in this important mission, because this is going to be a team of teams. It was going to take all of us together to get after it and solve it. This concludes today's event, and I want to say thank you, stay safe, and I'll see you on the high side.